Hi there, I'm Daniel Martin with today's World Health News, and in this edition we put the spotlight on Sjögren's syndrome and one of its symptoms. Since the disease was first identified in 1933, it's proven to have affected virtually every racial and ethnic group. Now, we still lack a general awareness about Sjögren's syndrome. The typical symptoms are painfully dry eyes and a dry mouth as well. For the first time in Singapore and the region, there's now a support group for Sjögren's syndrome sufferers and patients to share resources as well as connect with experts on autoimmune diseases and other related specialists such as rheumatologists. The support group is called the Sjögren's Syndrome Club, which will be launched at the end of April at its inaugural talk. Right now, one of those symptoms, dry mouth syndrome, or what's known as xerostomia. We're going to find out more about that with Dr. Ho Kok Seng, who's an oral and maxillofacial surgeon. Dr. Ho, welcome into our World Health News. Thanks for joining us. Let's explain a little bit about xerostomia first of all. What is it, and does it only occur with Sjögren's syndrome?
Xerostomia is basically a medical term for dry mouth. It's one of the hallmark symptoms of Sjögren's syndrome. Of course, Sjögren's syndrome itself has got a lot of other various symptoms. Basically, xerostomia is also known as salivary gland hypofunction, and as the name implies, it means a subjective feeling of oral dryness due to a lack of saliva. But if a person mention about dry mouth, it's basically a symptom and it's not a diagnosis. All right. So for this symptom to appear, basically a patient's or a person's unstimulated and stimulated salivary flow rate must be depressed to a certain level for us to actually determine or to diagnose the person as having xerostomia.
So this could be one of the key symptoms then of Sjögren's syndrome.
Yes. Sjögren's syndrome basically is an autoimmune disorder whereby the immune cells in the body starts to they do not recognize our own tissues as our own, and they start to attack. And in Sjögren's syndrome, basically they destroy the exocrine glands that secretes or produces tears and saliva. So as such, besides dry mouth, patients usually complain of dry eyes as well. So they may have a problem with very dry eyes, red eyes, and they complain of discomfort because of the general dryness due to the lacrimal glands that is actually secreting the saliva is being affected in Sjögren's syndrome.
Dr. Ho, how have you seen this affect the quality of someone's life?
Besides dry mouth and dry eyes, some of these patients do have other problems like nasal, nose dryness. In some female patients, they have vaginal dryness as well. And other organs of body can be affected too. But, basically, if you are looking at a person in general, the eyes is actually the window to the world. That's very important. So if a person has got consistently dry eyes, it can be very uncomfortable, and actually it actually affects their vision because they tend to have a lot of blur vision. As for dry mouth, as you know, mouth is, we use it to speak, we use it to eat, and if a person has dry mouth all the time, it actually affects speech, it affects swallowing as well. So in patients with quite severe Sjögren's syndrome, the quality of life can be quite severely affected.
Like you said, this is a symptom of Sjögren's symptom. So can we treat this symptom successfully?
If we are talking about xerostomia as the primary symptom in Sjögren's syndrome, the treatment basically involves finding the cause of the xerostomia or the dry mouth. In this instance, we are talking about Sjögren's syndrome. Unfortunately, there is no cure for Sjögren's syndrome at this point in time. So the management of xerostomia in Sjögren's syndrome patients basically involve us relieving the symptoms of of xerostomia. So in patients with severe Sjögren syndrome and with severe dry mouth, they tend to have a lot of problems with maintaining good oral hygiene because the saliva is lacking. There is actually lack of the protective enzymes in the saliva. Clearance of food particles in the mouth actually is affected too. And because of that, these patients tend to develop a lot of dental caries. They tend to be more prone to having cavities, and also because the saliva actually lines and protects our gums and our oral tissues. In patients with lack of saliva, they tend to get a lot of mucositis or inflammation of the mucosa, and they can get recurrent oral infections as well. So all in all, management will be geared towards more preventive dentistry. That means we like to encourage patients with dry mouth to seek early dental treatment or dental care so that we can pick up problems early. Unfortunately, patients with Sjögren syndrome tend to neglect the dental part of their management, and as such, a lot of them tend to present with quite advanced dental caries, and this needs more advanced treatment like root canal treatment, or in worse circumstances, extractions and then dentures or implants.
Dr. Ho, thank you so much for joining us on this edition.
No problem.
Coming up at the end of the month will be the launch of the first Sjögren Syndrome Club. You can find out more about it on its Facebook page. Just look for the Sjögren Syndrome Club on Facebook. For your World Health News, and speaking to Dr. Ho Kok Sing, an oral and maxillofacial surgeon from the Specialist Dental Group, I'm Daniel Martin from 938 Live.